Hi guys, my name's Megan and I've decided that I was going to start a video log or vlog about my trials with lupus. Lupus, in case you guys don't know what lupus is, it is an autoimmune disorder where your immune system basically overreacts and starts attacking your own organs and tissues. It can affect the heart, lungs, like the lining around those two things, your GI tract, your kidneys, your central nervous system, your, what else? Your skin, sorry, your skin, and a few other things that I can't think of right now. So the main symptoms that people see are fever, fatigue, ill muscles. That's what else it can affect. Fever, fatigue, like a fever that kind of just doesn't go away, doesn't really have a reason. Fatigue and muscle pain. There's also arthritis type symptoms where your joints are really stiff and sore, swollen and red. The most common symptom is to have a rash, a butterfly-shaped rash that covers both cheeks and the bridge of the nose, and that's where the butterfly symbol comes from for lupus. You can also get photosensitivity, which is when you go out in the sun you get really red and easily get rashes just on the parts that are exposed in the sun. Then there's also things like chest pain when breathing in deeply. You can get what feels like a heart attack, though it's not actually a heart attack, it's just inflammation around the heart in the pericardial lining. Then there's a few other things like headaches, forgetfulness. You can have strokes, seizures if it's affecting your central nervous system. You can have really often UTIs and kidney problems, so blood in your urine or cloudy protein urine. So that can happen. That can cause a lot of different problems with kidneys. And then another thing that happens a lot with SLE patients is that they will get depressed because SLE takes an average of 4 years and 3 different doctors to officially diagnose, which is a really long process, and it's a lot of tests and a lot of stuff that you have to go through before you actually get an answer. And I mean, people think that you think that you're going crazy because maybe, since they can't find anything, you're not sick or something, and that's not the case. They just can't find the answer. And and nausea, vomiting, stomach pain, that type of thing. So yeah, diagnosing of my lupus was a little bit interesting. Everything kind of all started. I was a pretty healthy girl growing up. I had a few problems like asthma and stuff like that, but nothing super severe. And then the almighty arm got shut in the door, in a car door, and so I had, I don't know if you can see, the scar goes all the way up to here. And then I have a scar on this side, which you can't really see in this lighting. Anyways, from here to here. But I had 4 surgeries to fix my arm because I got compartment syndrome, and if you really want to know what that is, you can Google it, but I caution you, it's really gross to Google. But I have my arm now, and but since I had the 4 surgeries, the 4 sets of general anesthesia under within 8-9 days, they said that affected my autonomic nervous system, and I got dysautonomia, which is when autonomic nervous system isn't working correctly, and that's what controls basically all your unconscious functions. You can look it up if you are really interested in what dysautonomia is. But anyways, I was doing pretty good with the dysautonomia treatments, which is basically Florinef and Cymbalta, to affect my fluid retention and my norepinephrine levels. And so basically I was doing really well for a little while, and then I started getting really bad pain fatigue type pain and fevers that just didn't really have a reason, didn't have a purpose. Started throwing up a lot. It was really bad. I wasn't keeping food down. I lost a ton of weight. Weight loss is another common symptom of lupus, which I didn't really have any weight to lose at the time, and I still don't actually. But that was going on, and so, I went to a neurologist first because it was mainly pain in my legs, spine, and upper arms. That's still where it is. And they did a blood test, and it was an ANA test, which is an anti-nucleic antibody test, and it came back positive. So that isn't really a key sign that it is lupus, but that does mean that lupus is a possibility. It also could mean really any type of autoimmune disorder, like RA or other things like that. I'm blanking right now. And so that sent me to rheumatology, and the rheumatologist did 1,001 tests. My gosh, any test you can think of, like, I'm pretty sure he ran it because he was going to get to the bottom of things. But it came back that my building blocks to my immune system were weak, and my inflammatory, I don't know what it's called, my inflammation was pretty high. I had lupus markers in my blood results, and so that, along with a lot of my symptoms, which the main ones were fever, fatigue, pain, mouth sores, skin rash with sunlight, headaches, vomiting, weight loss, shortness of breath, and a few other things that I'm not thinking about right now. But with all of those symptoms, he diagnosed me with lupus, and we started on NSAIDs for a little while. And the NSAIDs actually were given to me by my neurologist because initially I was in too much pain to even like function. But then I started to vomit blood and pass blood in my stool, which is TMI for some people. But so we had to stop the NSAIDs because of all the stomach issues it was causing with me. So we stopped that, and my rheumatologist put me on prednisone. Yay, prednisone. Woo! For anybody who's been on prednisone, you know what I'm talking about. It is a medicine with side effects that mostly my two main side effects are nausea, but I can't really tell if it's a side effect or if it's the drug. If it's a side effect or if it's the drug, that's the same thing. If it's a side effect or if it's just the lupus. So that, and then anger. Quick to get angry with like everything. Like I'm ready to smack somebody across the table for chewing with their mouth open. Most people experience weight gain and headaches, and some cases people experience like dizziness, vertigo type feelings. I haven't really had much weight gain. My face has gotten rounder, but I think that's more because I'm already on Florinef, which is a fluid retention medication, and with that, and then the prednisone on top, all the water I drink, this like giant jug of water here. This is my best buddy. Keep it in my room so that I can have water at any time needed. But with all of that, they officially had me on the prednisone, and I was on 40 milligrams to slowly decrease to 10 milligrams over the course of a month, and then I was going to see him again. Well, I had it for 2 weeks, got really sick, fever, high fever, and throwing up a lot, really, really achy. Felt like I had the flu. So they said stop the prednisone for a little while, and so we stopped it for a week, and then the pain came back with a vengeance, and totally wiped me out. Throwing up, rash everywhere, just not fun. So we're back on the prednisone at 20 milligrams a day. until the 10th, January 10th, when I see my doctor again. And he also has been talking about trying to start me on a chemotherapy drug or Benlysta, and we were going to start it, but since my last time I saw him, it didn't go so well, so we just did, I don't know what he called it, a cocktail of some random stuff, and then prednisone, and then B12 injections. That was the last time I saw him. So we're going to try again on the 10th, and hopefully that goes better for the both of us. So yeah, that is the quick intro of my diagnosis process with lupus and where I am medically. I hope that I didn't bore you all to death, because I'm kind of boring myself talking about it right now, and I've already made it to 11 minutes. So anyways, stay strong, and remember, we got this.